name's Paul Kane, and I own Summit Physical Therapy. If you can see right there, up on Borland Road, just over south of the hospital. Some of you may have been to me before, but others that haven't, welcome to my seminar on shoulder pain. I suspect that people are listening to this and looking at me today because they have had some form of shoulder pain in the past, or their wife has, or their husband, or their loved ones. I'm wondering if that's the case, and by all means, you can type in questions to Marilyn at any time, and I'll answer them at the end of our seminar, our workshop. So I guess the first thing I will prefix this workshop with is by asking people, why does my shoulder hurt? Does your shoulder hurt at rest? I.e., even if you're just sitting there doing nothing, does your shoulder hurt or ache? And that's obviously a pretty bad sign because it's hurting all the time. Most people have pain in their shoulder when they move it, usually up to the front or out to the side, oftentimes putting their hand behind their back, and oftentimes also this movement called external rotation. And that's a sign of a certain type of shoulder problem that I'll get into in a little bit. Sometimes people just get stiff and stiff and stiff. They find they're not that painful, but they absolutely start to not be able to move their hand, move their arm. And that's usually accompanied by pain, but sometimes just stiffness. And that's another problem that we'll get into as well. Sometimes people have not so much pain, but they have numbness and tingling. And often it comes down the arm or down from the neck and into the shoulder and down and into certain fingers. And that's a separate problem that's usually not related to the shoulder, although sometimes it can be. And sometimes the person's been diagnosed with something by the doctor. We'll go over what the doctor meant and what I think the doctor meant when it comes to his diagnosis. So the first thing I think I want to emphasize to people is when people get shoulder pain, what do they often do? And the worst thing they can do is ignore it, because ignoring your shoulder just means that it has a propensity to get worse. Because just like every joint and muscle group in our body, we are designed to move. And if you absolutely don't move it, unfortunately, the shoulder is probably the most susceptible to becoming stiff and frozen out of any other joint in the body. The shoulder is the most mobile joint. It has the most shallow cup, and compared to, say, the hip or the knee. And it's very, very susceptible to getting stiff if it doesn't move. So basically, I'm going to go over a little bit of anatomy first, because a lot of people don't quite get how the shoulder moves, and the words and the names, they get confused. And so I thought I would do that first. People often hear the word rotator cuff, and they turn it into rotary cuff or rotary cup. And those are words that are actually incorrect. The rotator cuff is all it is a group of muscles and tendons that connect the arm bone to the shoulder blade. And this is a nice little model of what the shoulder looks like after you took off the big muscle in the front, and if you took the skin and a couple of overlying muscles off in the back. So this would be my right shoulder. Do you see, everyone see that?
I want to come close.
Or, yeah, I'm going to come closer here so that you can see this up close. There's a life-size shoulder, okay? This bone here is called the clavicle, and you can reach up and feel your own clavicle right here, okay? This, of course, is your arm bone or your humerus. And I can actually do something pretty gross here. I can actually pull it out. And so this is what it looks like right there, okay? And this is actually what would be looking up there would be, you see all this white stuff, the gristle, and the brown stuff, which is the muscle. That's what forms a cuff, just like the cuff of your shirt. which is a group of muscles going almost 360 degrees around. So I'll just tuck him back up in there. And you can see that this guy has actually created his own rotator cuff tear, which he's in bad shape. But this is basically giving you an idea of what it all looks like there. So now if you think about this, muscles, as you know, they contract, right? So all this brown stuff contracts, okay? That's what a muscle does. That's all it does. Muscles does two things. They contract and they relax. And so when that muscle, if a muscle directly attached to a bone, just think about when you, if any of you guys out there fish, and you put the fish hook through, say, the lip of the fish, then obviously that's going to catch on the fish and you can pull it out. But what happened if you put the fish hook through the muscle of the fish, through all that the soft stuff that you eat? Well, obviously it pulls right out. And that's exactly what would happen if we stuck something in these muscles here. So if a muscle connected to a bone, it would just pull straight off. So what does a muscle do? It connects via a tendon. And that's what the white stuff is here. A tendon, it's the gristle, and that's all gristle and tendons are. They are thick, fibrous rubber bands, if you like, that hold muscle onto bone. So when I look at this muscle here and he contracts right up here, then he's going to do that. He's going to pull on the tendon and he's going to lift your arm up. And that's how your shoulder moves. All of these muscles have a function to play at lifting your arm in certain positions. And if you could just figure out where the muscle starts and where it ends, you can figure out what it does. And that's what a rotator cuff does. So if this muscle here, which is on the inside of your shoulder blade, which is kind of hard to figure because all the ribs are in here, but this is the muscle on there. If it starts deep in there and ends right up in my shoulder on the front of my shoulder, then that muscle is an internal rotator that pulls your muscle, pulls your arm in like that, which is important if you have pain when you do that, because we can isolate and find out, well, you have a tendonitis or maybe even a tear of the tendon that does that movement. Likewise, this muscle on the back, okay, by the way, this bone here, you can reach up and feel the scapula. You can feel that part of your scapular bone nestled underneath the shoulders, the muscles that shrug your shoulder. But anyway, the muscle that goes underneath that, it's not really touchable or feelable by you. That comes up here, and if it contracts like that and tightens, then he rotates that outwards. He rotates your humerus bone, which does that. And a lot of people have pain doing that. So a therapist checks, what's your strength like? I'm sure some of you have been to the doctor, and the doctor goes up and he says, push against my hand, and you go, ow, and he writes down something. And my job is to explain what I think he's trying to get at. Okay. Now, what we've found, science has found, is actually the rotator cuff muscles all work together, okay? They don't really work in isolation. How many people do this all day? No, we lift our arm up. And the one thing the rotator cuff muscle has got, or group of muscles has to do, is a very important thing. And when we get pain and shoulder pain, we find that the muscles are not doing exactly what they should do when we go to lift the arm up. So when I lift my arm up, because I don't have pain right now, my rotator cuff muscles are doing something very important. They are all contracting all at once, here, here, and here, and even at the top, to drop and hold that shoulder down while the big deltoid muscle, the muscle that you do feel, is lifting the arm up. And so they are doing a very important job. They suck the shoulder bone down and in so that the arm can then move up like that. And if they don't do that, if there is a problem with the way they move, then guess what happens? Can anyone guess? it jams. The shoulder jams up like that. And what do you think happens when it jams up? There's a bit of space there, but it's not that big, is it? So in fact, whoops, that would be bad. That's called dislocation, and that happens. That becomes a pinch point, and there's a little fluid-filled bag or a sac under there called a bursa that gets inflamed. And so I don't hope to not be too complicated here with you, but that's a summary of what the shoulder looks like. It's called the rotator cuff. Its muscles connect tendons to bones, which then move. All right. So what are the other things that can happen with your shoulder? Well, when I talked about pain just at rest, like, oh my gosh, I just started hurting, that depends on why it hurt. Probably, possibly you reached up high and felt something, and then you sort of go, oh, what was that? Or you maybe fell down, and that's where a lot of people get shoulder injuries, including rotator cuff tears or dislocations of their shoulder. But when you have pain that is unrelenting, that's probably involving that bursa that I talked about. And all that is think about those water balloons that you have when you're a kid, when you were playing, you know, on someone's birthday, you had those water balloons and you threw them at each other. That's what a bursa is. It's a fluid-filled sac, and it's there to lubricate a joint. And sometimes that gets swollen and inflamed, okay? Now, I will say, in the absence of any other problem, a acute bursitis like that is best treated by an injection of cortisone. It takes the pain away immediately, okay? That's the one time I will say that get to the doctor, and as long as he does the right examination and says acute bursitis, then a cortisone shot is by far the best way to go, because it immediately shrinks the painful area. But most of the time, that's not the case. It's pain when we move, okay? So what I think people do, which is another, I mentioned what they do is ignore the pain, is what they tend to do is go, I don't want to move. They can sometimes put their arm in a sling, and occasionally putting your arm in a sling is okay, but don't keep it in a sling. You've got to slowly move it. We've got to start both passive and then active movement. So putting your arm in a sling, unfortunately, has a couple of problems if you have it on too long. And we don't know why this happens, but for some reason, if in one particular period of time when the shoulder doesn't move, there's a cascade of events that happen, and that fluid, that little water balloon that we talk about, becomes like the fluid it becomes thickened and more like motor oil. And then the capsule itself, a capsule is a sac that covers the entire arm, and there's ligaments that all come over it too. That gets all hardened and contracted. And then suddenly you go, oh my gosh, I can't put my arm out. I cannot reach. I can't pick my wallet out of my back pocket, or I can't put a belt on or something. And with women, putting a bra on, that can be extremely tough. And that means that you're in the process of starting to become stiff, which can take a year or more to get fixed, okay? At my clinic, we make sure that you do not get into that phase by doing specific targeted exercises, especially stretches, okay? One of the other things I talked about was if you fall on an outstretched arm, you fall down on your elbow, there's always a damage of a dislocation occurring. There's always a danger of a broken bone. And of course, an x-ray would have to be there to show that. But what mostly happens is the rotator cuff gets torn, okay? And that means that suddenly you have a lot of pain, or you can't do a rotation type movement. And especially you can't lift your arm to the side. If you're the most commonly affected tendon, the supraspinatus, is involved and it's completely torn, this is what happens. you say, I just can't move it. It sometimes doesn't even hurt. It's just like, I cannot move my arm to the side. What they do is, you might see people do this. Oh, I can do it now. And they get up here and they can actually move it. And that's because the big muscle in the front along the side, the deltoid, can finally grab. And there's nothing wrong with that deltoid muscle. It can work from here and up here. But the beginning of the movement is the muscle that has torn. And that is called a complete tear. And it's easy to see. You do this and then you like that. And so what normally happens, though, is the tear is not complete. It's just a partial tear. And that all depends on how partial it is. Is it deep? Is it wide? Is it shallow? The good news is studies have shown that most of those do not need surgery. They rehab and heal with specific physical therapy protocol and a specific physical therapy strengthening routine. So I encourage you, if anyone has any of those type of symptoms, pain lifting their arm to the side, I'm happy to take a call, free phone evaluation. Marilyn will put the link up in the future, or I think it may even be on the link you got. But feel free to call us and we can go over your symptoms on the phone, and even possibly come in here and I'll do a brief evaluation of what your shoulder looks like. Now, the other thing that some of you folks out there being elderly might have been told or you suspect is arthritis. And that the word arthritis is kind of meaningless because it just means inflammation of a joint. But in this case, your joint is absolutely arthritic, and that would be an x-ray showing that the joint space is down to nothing. And you're really stiff, both actively and passively. I couldn't lift your arm any more than here. I can't lift it here, and I can't lift it here. Slightly different than a frozen shoulder, but sometimes related. I will put a plug in. Recently, until about 10 or 15 years ago, nothing could be done. People with bad shoulder arthritis, there's really nothing that could be done. But recently they have developed a way to replace your shoulder joint. It's pretty neat. There's two types of shoulder replacements. One is a total joint where they cut off the end of the bone and they hammer down a ball and they hammer down a socket on the other side. And another one is called a reverse total, where they actually reverse it, where the ball and the socket, like a normal one, becomes a socket and a ball, which sounds very bizarre, but it works very, very well. If anyone out there was told by the doctor that they need a reverse total shoulder or a total shoulder and they're confused, there's some good stuff online for that, or feel free to call me and we've got handouts and things that explain it. All right. So let's get back to what people do and what they should do and don't do and things. Firstly, they ignore it. They hold it. They think it's going to get better, which is not right. Then they try and alter it, which is, okay, I'm going to take pain pills. I'm going to take anti-inflammatories. I'm going to ice it, or maybe I'll heat it. Some of which can be helpful, but they don't get at the root cause of the problem, which is what is causing the problem. So in some cases, it's like what I said, a muscle imbalance where the muscles of the rotator cuff aren't doing what they should be, or a tear or a partial tear, which is more commonly seen, and a partial tear requires specific physical therapy. Or they have, hopefully, if they've fallen, they may have partially dislocated their shoulder. That's a different problem. And that revolves around, again, specific passive movement program, and then gradually increasing and becoming an active exercise program. I will say that there is another structure that often is involved in shoulder pain. This is more to do with kind of younger people. So if any of you out there are younger and have had injuries on the job, then this is more likely to affect you. If I take this guy out again, and if you look up under there, there's the bone, the socket of the shoulder blade has got a rim of cartilage around it called a labrum, and it runs around the rim of the shoulder blade and that makes that socket there, which is not very deep, makes it a little deeper, and that labrum can tear and cause its own problems. And sometimes you do have to have surgery for that, and then you have to do rehab afterwards. So there's another thing. And the people that are into anatomy might say, well, there's one other thing that you haven't talked about, and that's this guy here. You see this dude that comes along here and he turns into a muscle here? Does anyone know what that's called? Well, that's the biceps, okay? He's not actually part of the rotator cuff, but he goes way up into there, and you can imagine if you get pulled or yanked on, that whole tendon can pull on that labrum or that little shallow rim of cartilage and pull it out. And that's what often happens with shoulder injuries at work, or where you catch your arm and it's tractioned. And this guy is a problem too. And they have to occasionally do surgery to reattach from this guy down here so that he's no longer pulling on that labrum. All right, so that's probably enough about anatomy. I'll put him together again, and we can go back to him as we need. One other thing too is people might have had dislocated collarbones or even broken collarbones. And you can see that this collarbone or clavicle goes and attaches way up into the shoulder area. Does anyone there, you can actually feel that bone, and when it ends right here on the shoulder. Some people's raised up like that. They've dislocated it when they were younger or even not so long ago. And those ligaments here have been stretched, okay? Some of them have been torn. Mostly they don't do anything about it now, and you go about your daily activity.
Just went blank again.
I'm going to hold on and see if they're connecting.
I don't know if it's our internet.
Shouldn't be.
It looks fine right now for us.
Does it?
Oh, is it? Okay.
It just went black here.
Sorry. I'll just keep talking and hopefully.
Okay, now it's back to normal.
Okay, so it's back to normal again. I apologize. Our side had a bit of a glitch, but I'll keep talking. I'm not saying that medications are bad per se. Sometimes they get you through the day, but it's important to understand that they mask the problem. And ice, which is another appropriate thing to do for acute pain, that's not doing anything except cooling the joint down, which is a good thing to do, but it's not a cure as well, okay? By the way, another thing I offer up here are handouts, free handouts that explain top exercises for both neck and shoulder issues. If anyone wants them, you can give us your name and address, and we can send some of them to you. I feel we've got plenty of these to give out as well. Which brings up the third thing. Some of you out there would be maybe having some pain in your shoulder, but your shoulder doesn't feel too bad. Maybe having a bit of numbness, tingling, goes down from your shoulder, down in sometimes even into your fingers. Well, that way we can tell if it's the neck that's causing the problem. The neck is radiating and causing pain into your shoulder. That is a thing called referred pain, and that's something that's very intriguing. Some people say, oh, my shoulder hurts, but a therapist or a doctor looks and asks them to do things, move things, and finds a different form of weakness, which was weakness caused by nerves being pinched, okay? And that means that all your shoulder pain really is coming from your neck, and we have to look at your neck. Sometimes if your shoulder pain gets worse when I move your neck certain ways, or there's pain and it also is a spreading numbness going down your arm and into your hand or not into your hand, sometimes it stops there, then there's a good chance that your problem's not coming from the shoulder at all, that it's coming from your neck. therefore, there's no point in working on your shoulder. It's just, we have to work on your neck through manual therapy and appropriate exercises, okay? I know I'm bouncing around a bit, but let's go over some of the other things when surgeons and doctors are important. When you've gone on, you've tried physical therapy and it hasn't done enough, sometimes the impingement or the rotator cuff tear is big enough that there's nothing you can do, and they do have to go in there and stitch it up. And what they'll do is, I'll just come up closer again. The doctors do what's called a decompression. And what they do is they take a little piece of this bone in here, that guy, up. I really have to, well, no, they take this piece of bone off here, they shave it off, and they sometimes even take this ligament off, and occasionally they even take the whole bit of the clavicle off to really open it up. And then they go in there and stitch up the repair, or stitch up the tendon that's been messed up. And what that does is give it a lot more space. And that's why you can then lift your arm up without that pinching occurring. Although I think it's always good to get strengthened so that those muscles do their job in the first place. All right. So that's another thing that doctors do with decent success. As I say, the first advice is physical therapy. So what about exercises? I'll go over a few here. I've got some gizmos that I use myself. If you look here, this is called a pulley. And the first thing, this is a good exercise to do for anyone who is thinking of moving their shoulder, but they can't, it hurts to kind of lift their arm up. So first thing we want to do is something passively, okay? A pulley is a good idea. You can make one. So guys out there, ladies out there that are decent with getting a $2 pulley and a way to attach it to a door. But most people, you can just buy one. And I have these things here. I'll just put one up, tie it onto the door, and hopefully people can see me. There's an example, flexion. It's a nice passive stretch. Say my left arm is coming up for the ride, and I'll hold for about 15 or 20 seconds. Bring it down, and then out to the side. Same thing. My palm is up. Hopefully that everyone can see that. Okay, I got a big smile because it feels good. And I would encourage people with shoulder soreness to do that regularly. I also, for you golfers out there, golfers love to use their own equipment, right? And so I found that this is quite a good thing for people with shoulder issues, and old golfers often have them. So here's one exercise. You can hold the head of the club. And when you do that, push with your left hand for a right shoulder problem. It's a right shoulder problem. That gives a nice stretch to this area here. Got it? Okay, hold it there. And if people have issues with putting their hand behind their back, the old golf club, there's a nice, you can pull your arm around and sort of feel that you can hold on to that head of the club, and it's quite comfortable that way. Of course, you could use an umbrella, you could use a cane, similar thing. Another one you could do is the external rotation, or this guy. Okay, so you tuck into a chair and you rotate, and you feel that rotating outwards. Okay, so those are kind of like the 4 or 5 exercises that give the most bang for the buck in terms of stretching.
Explain what passive means.
Yeah, passive means something other than your own muscles getting your shoulder up. So this is called active because my muscles are working. And if I held my arm and did that, that's called passive. So as a therapist, we'll often write down passive range of motion is X number of degrees. active range of motion, X number of degrees. And again, to reiterate, we can tell what shoulder pain is like if people have good passive range of motion. Look, there's no stiffness. That's easy to do. Or if I did it with the pulleys, but then I do this, oh, it hurts. It hurts, especially in this range of motion here. That noise you hear is my office manager, Teddy. He's four-legged. And he's sitting there now. He's thinking it might be time to get some lunch, but he's way too early. All right. So you want to show them Teddy? There you go. Say hi, Teddy. All right. All right, Teddy. Back to the instructions.
Come here.
Okay. So what that tells me is that the problem is in the muscles and the tendons. It's not in the capsule, which would be tight. Okay. So that's the difference. Now, what else do I think people should do on a daily basis for stretching and things? Often people have heard about the wall walk, and that's fine. You can walk your hand up the wall. You can kind of stretch. Some people have trouble doing that, in which case I would say they can get to a table or a high table, and they can lean forward, or they could stand. And this chair is not really big enough, but if you lean forward while holding on to a chair, that can be a good stretch. And sometimes if you push your hand down into the chair, you make the muscles contract. And then as you come down and bend, I'll do it this way, you notice that me bending my knees means my shoulder is actually moving higher. And some people really have problems all the way to there. So this would be a good first exercise. Again, it probably needs to be shown personally. So I encourage you to either go online and look at some of the videos there, or again, give us a call. Okay, so what else is good? I have a stick here, which is just simply a piece of dowel. It was, broom handle or something like that. And you could imagine if I was lying flat on my back, lifting my arm up. Often this is good because the other hand does the work. And I would bring my arm up over my head, hold it there, and then bring it down. I like 15 to 20 seconds, sometimes 30 seconds. You can do the same thing. Oh, and that's right. I didn't show you this. The golf club does this too. Look at what I'm doing. I'm stretching my left hand. I'm stretching it by making my right arm move. You don't even need a pulley to do that. And with my palm up, feels good. I'm getting a deep stretch in the shoulder muscles there. Okay. All right. So those are the stretches. Now, in terms of strengthening, there's general strengthening and then there's specific strengthening. And I want to just show you something where I get a lot of my, especially older, but not so much older people have in terms of our posture. As we get older, we tend to do this. We tend to slump. All right. Now, if I try to lift my arm up and I'm slumped with my head like that, it's hard for me to get any more than that, which causes its own problems with pinching. But if I did that and I did that, then of course I can go much further. Now, this is simplistic, and I'm not gonna say, well, everyone just sit up. But what we can do is do things that help the shoulder move backwards in its socket instead of forwards. And so one of the most important things is this guy. Doesn't have to be pink. Look at my shoulders. They're coming out. I'm feeling a pinch in my shoulder blades right behind you. I don't know if you can see, but my shoulder blades are coming together. Out, hold, feel it tighten in the back. And look, it's doing a good active, it's making the shoulders come back. We tend to be on computers too long. And as we get older, everything sinks that way. We got to do that way. It's really good for the shoulders. All right. Arms then can come up. The other one is you can do strengthening. This would be for a weak rotator cuff. Bearing in mind, we've got to watch out if it hurts. So this can be done like this, 2 sets of 10. Feel it really work. And you can tie it to a doorknob like this guy. And a lot of these can be similar. Most people have probably been shown or have been seen to do these specific. This would be for one arm. And of course, if I turned around, I'm not turning around, I'm just using the other arm as example. That would be the rotating in. But notice I'm not doing this. I'm not doing that. I'm rotating in like that. Okay. And other things you can do is flexion with some resistance, or punching. Again, the punch is quite good because when you punch out, your shoulder's actually coming back. So there's nothing wrong with that exercise either. And then all sorts of various rowing, which is again a shoulder blade pinch done what we call bilaterally with both shoulders. I'll just show you. You're going to see my back. Back and down. Not backing up, back and down. Okay? That would be a good basic kind of shoulder hygiene exercise program for you. I honestly would say you should start with strengthening. Start with the rubber band first and end with the pulleys or the golf club or the stick, because studies have shown that shoulders stretch, that all muscles and tendons stretch better when they're warmed up. So that would be a nice little program of things to do at home.
Where can they get a rubber band?
You can get a rubber band from me. You can go to Dick's Sporting Goods, or if anyone are online, there's multiple things on Amazon and other places. But I have rolls of them here as well. And like I say, there's plenty of online sales as well. You'd have no trouble finding a rubber band. I think that covers most of the things that I wanted to do. Marilyn, are there any questions yet from anyone?
We had a couple questions, but you answered them as you went along. So if anybody has any questions, go ahead and enter them into either the Q&A function, or you can use the chat function. Those are going to be at the bottom of your screen if you are using a computer, or they're going to be at the top of your screen if you're using a tablet. So let's give everybody a couple of minutes to type in any questions. I'm also going to put the contact information for Paul in the chat right now.
Good, thank you.
There's that.
And while anyone who has any questions, while they think about what they'll do, I will say that obviously general exercise is very good for your shoulder as well. Now, I'm not going to ask you to do heavy weightlifting or anything without a good analysis of where your baseline is, but doing a general strengthening program at the gym now that they're reopening, or at, Juanita Pole, is that reopening again? I'm not sure. Hopefully, we're in the last phases of this. I think by middle of June, things will be able to be getting back close to normal. So the gyms will be more reopening at full volume. And then a walking program, a nutrition program, make sure that you have the correct, nutrition. Don't let, things like too much sugar or carbohydrates get you, because funnily enough, things like diabetes are linked to frozen shoulder. Yet another thing that you don't want to get involved with. So I encourage you for that general health. And of course, any smokers out there, stop smoking. That has not just, we're talking about general, but in terms of actual impact on the structures at the cellular level in your shoulder as well. So absolutely, your doctors harangued you for years to stop smoking, and I'll encourage you to help your shoulder as well as everything else. Okay.
Paul, we do have a question. The question is, do you have any recommendations for making workspaces more ergonomic for shoulder pain or stiffness?
Yeah, good question. Obviously, it's true that when you sit and type, you can have a propensity to slouch, which of course moves your shoulder forward. And depending on the height of the keyboard and monitor, because if it's down and you're on a laptop, this can be an issue all day. And of course, it would be logical to think that there's going to be more pinching in the front of your shoulder and a sort of a position of less and less movement. You know, I like to think of as human body as moving in boxes, right? And if you are what nature gave us in terms of our ability to move, and of course, as we get older, it gets a little smaller, but this is a box way high. I can look up and reach way up here. If you are sitting all day and you start doing that all day, you start doing that, suddenly the box gets like this. Therefore, you try to reach everything a little higher than that, and you're not able to. It hurts. And so what do? You ignore it, and you say, well, I'm going to put everything down here, and then becomes less and less of a box. Now, regards to the ergonomics of your workstation, yeah, I would say that the classic advice, I don't have one. I have lumbar cushions that, of course, would encourage someone to sit back in their cushion. I would say generally you should have your hips a little higher than your knees. If your knees are up here, I mean, that obviously tends to not be easy to keep your shoulders back. So I would say that lumbar support, and whether or not you have a support here, like using the arms of a chair or getting an ergonomic chair, sometimes they're expensive, I get that. The keyboard wants to be closer to you so that you're not reaching, and that gives that extra little bit. This is all standard sort of advice. And that the monitor hopefully is more at your eye level, because if it's down, of course, and that can actually feed into some neck problems that we talk about. So another thing is, I don't know if the person that gave me that question is younger or older, or if this is related to their work, that standing desks are now quite in vogue, and I like them. I think they're good. You know, you basically can walk around and you stand with the monitor like that, and that's probably better for the body, at least a mixture of it, so you're not sitting absolutely all day. But another thing you can do is, if you're at the computer a lot, is put a little teaser on your computer, say, get up and move 5 minutes every hour. So it'll say, beep, 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 get up and move. And I like that. I think that that's good. Too many people get stuck in a project and they get stuck and stuck and stuck. And that becomes a problem for all sorts, including their back. But thanks for the question.
Great, thank you. We have another question. This person is asking, they say that they have calcification in their rotator cuff. Would the band exercise?
Rotator cuff.
Rotator cuff, sorry. And then would the bands and the recent exercises that you showed, would those be helpful?
Yeah.
For that particular issue?
Sure. Well, I will caveat this by saying that this is a general workshop and things, and specific advice for a specific patient is I would have to, talk to them individually because there's some history that would need to be gone over. I don't want to give them the wrong exercises for the wrong problems. But in general, I think that exercise routine would be good for them. There's nothing unsafe about that routine. And again, I don't know if they can relook at the video or whatever, but I've got, that routine available here if you want to give us a call and we can send it to you. But let's go back to the diagnosis. They were told they had calcification, and that's something I didn't touch on, but yes. So calcium deposits a little bit of what is actually makes bone up. And before you go, yuck, I've got a little bit of bone in my tendon. It actually is quite common. And some calcium deposits don't cause any problems at all, but others do. It all depends on, is it a calcium hook that comes off the bone, or is it a calcium that is showing up on x-ray as a little bit of a shadow, and it's right even within the tendon. And some people have calcium and their body reacts to it by inflaming, creating that aching pain. So again, I can't answer your problem specifically because I haven't looked at your x-ray to find out exactly what it is. But in general, most people have calcium deposits, doesn't hurt. Some that do require some specialized attention. And those exercises would be a good first step. But just remember, I'm not guaranteeing in your case, sir or madam, whether that would be good for you. You want to give me a call. Okay?
Great, thank you. It doesn't look like we have any more questions. So I did
But
put
that's good
in the
because
chat,
it's right on 10 and almost 11. Well, it's
yes,
9 minutes too. Yeah.
So I did put the information for contacting Paul in the chat. I am also going to send a follow-up email after this, which will have the recording for the event and that contact information.
Right. And Marilyn, is Juanita Pole reopening again?
So we do not yet have guidance on that. We are sort of planning for whatever the case may be. So if we are able to reopen, then of course we will put a plan in place to allow us to do that safely. But in the meantime, it's all virtual still.
Right. All right. Well, thank you so much, everyone that jumped on this call and on this workshop. And I hope that I gave you some information that is helpful for you. And like I say, doing nothing for a shoulder tends to be not a good idea unless it's one specific type, which is an acute bursitis. But even then, I would say that you should get to a doctor. But thanks so much for listening to me and things, and have a good day.
Thank you so much, Paul. Really appreciate it.
All right, everyone. Thanks. Bye.
Bye.